the reciprocal flexion extension. Okay, this is Morose reflex. Okay, you just leave the head for 15 degrees and hold the again head. Okay, there will be sudden abduction and extension of the upper limbs followed by adduction and flexion of the upper limbs. That is called Morose reflex. Okay, these reflexes, if they are present from birth to 3 months, are normal. If they are absent, then it indicates some kind of depression in the central nervous system. If these reflexes are persisting beyond 3 months, then it indicates sensory motor dysfunction in the central nervous system. Okay, these are neonatal reflexes. And we'll talk about, there is something called automatic reactions. We have 3 automatic reactions. One is Landau's reflex, one is Gallen's trunk incurvatum reflex, and the third is parachute reflex. What is Landau's reflex? The Landau's reflex, the body's position should be in prone suspension with your hand holding up the chest and abdomen. Understood what I am talking? The body's position should be the stimulus. The stimulus is active or passive extension of the head, and the response is trunk extension increases and hips will extend. It will appear from 3 to 5 months and it will disappear by 8 to 10 months. Now I am talking about the Landau's response. Okay, the position should be, okay, prone suspension. The chest and abdomen should be suspended on your hand. Understood? This is the body's position. The response, the stimulus. What is the stimulus? You can passively extend the head, or if the kid extends actively, that is the stimulus. If the kid is not able to extend, you can passively extend the head. The response is there will be extension of the trunk and extension of the hip. Understood what I am talking? I'll show the picture. See, trunk extension increases and hip extension increases. Prone suspension with chest and abdomen supported. Okay, extend the head. This is the stimulus. Response is trunk extension increases and hip extension increases. This is called Landau's response. Is it clear what I am saying? Yes. Okay. The next one is Gallen's trunk incurvatum. Gallen's trunk incurvatum response. The body position should be on prone line. Okay. You stimulate with your finger from shoulder to buttock 3 centimeters lateral to the spine. The response, lateral flexion of the trunk to the same side, which is present from birth to 2 months. Now we will talk about Gallen's trunk incurvatum. Baby position should be on prone line. Okay, the baby should be undressed. Okay. With your finger, you stimulate 3 centimeters lateral to the spine from shoulder to buttock. Understood? Just stimulate like this. Okay. This is called stimulus. Response is when you stimulate this side, the trunk will flex towards the stimulated side. Understood what I am talking? Yes. If you are stimulating on the right side from shoulder to buttock 3 centimeters lateral to the spine, that is the stimulus. Response is lateral flexion of the trunk towards the same side. Okay, it should present from birth to 2 months. Is it clear what I am talking? This is called Gallen's trunk incurvatum.
You can't feel it, Mark.
You can see the picture. Okay. The kid should be on prone line. You stimulate with your finger 3 centimeters lateral to the spine from shoulder to buttock. Lateral trunk flexion towards the stimulated side, which is normal from birth to 2 months. Is it clear? That is called Gallen's trunk incurvatum. The last automatic reflex is parachute reflex. What is parachute reflex? the whole child horizontally, okay, in space under the axilla. Okay, whole child horizontally like this in space under the axilla. Lower head first with moderate speed. Response: protective extension and abduction of upper limb to touch the plinth to prevent head from touching the surface. See, hold the child under the axilla, under the space. Okay, this is body's position. Stimulus. Okay, lower the head down. Understand what I am talking? Okay, this is the stimulus. Response is, as soon as you lower the head down, the kid will abduct and extend the hands to touch the plinth to prevent the head hitting the floor or the plinth. Understood what I am talking? It should appear from 5 months. It will be present throughout the life. Understood what I am talking? So please do understand that. Hold the child horizontally under the axilla, in space under the axilla. Okay.